Audible. Thank you. So, my topic is small incision cataract surgery, a literature review. There is no financial interest. When you are seeing the global rate of the cataract surgery seen by this WHO data, you can find out what are the things it's going on and what is the data which you have to look into there. Here you are seeing that these data are increasing day by day. When you have seen this is exponential increase in the number of cataract in the world everywhere because the number of aging pupils are increasing. And so I searched various literature reviewed based on the 3-4 common points or differences between the SICS and the another surgeries. What is the time, what is the cost, whether machine dependency or the grade of cataract or what are the learning curves. So regarding the time, when I've searched, I found various journals. Even these 6 journals are the articles having some showed what is their literature time or the daycare surgery, what we are going to say for the cataract is. Then we can find out in case of phaco and SICS, almost it is having same time. You can find out these are the data for the SICS time taken by this published literature. All the literatures taken are from the PubMed index journals or the high impact factor, not any another journals. So here you can find out that the SICS as per the published literature is taking almost same or the lesser time. When we are going for the cost effectiveness, yes, there are 2 type of things. One is the phaco, another is the SICS. And in the phaco you can find out we required initial higher amount of money to set up. These are the things which we have in our mind. And for in the SICS or MICS, the setup is relatively cheaper. But when we search the data, again we reviewed, these are the various studies done in the India, one by our scientific secretary, Dr. Gogat et al. And different, these are produced in BMJ and everything. Here you find out what is the rate and difference between the rates of the surgeries of phaco and SICS. And this is a wonderful article published by in the Lancet and WHO data, and they find out that in the standard scenario, the SICS will cost almost 30 to 67%. Why there is so much difference? This difference is because of the which type of lens used. Because nowadays smart incision surgeries are going on, and many authors like Dr. Rawat Boramani sir, they are using even multifocals and different types of foldable IOLs. So the cost of foldable IOLs or the IOLs depend upon increases or decreases the cost of surgery, but overall the cost of surgery in SICS is lesser than the phaco when the consumables are used. Now the grade of cataract, again it is said that SICS is done in all grades of cataract, and this is strongly supported by all the data we have seen in the volumes and the literature, and the maximum number of data published by the cases by the Dr. Haripriya Arvind from the Arvind Eye Hospital. And according to her study, it is good for high volume and high quality. So SICS is the surgery which is to be done in the same setup with equal number of volumes in faster time and everywhere. And these are the data you have searched from 2005 to 2012, almost 10 years data is there, and you can find out everything is there. When the post-operative visual acuity is concerned, here we can find out the post-operative visual acuity, the unaided visual acuity. This is the statistical zone, and these are the various studies in which we have calculated, and we find out this is the ideal data, and you see that whole data or the visual acuity fall in this diamond triangle. It means unaided visual acuity 6/18, either phaco or SICS, no issue post-operative. And for the unaided visual acuities at the 6/9, you can find out SICS is slightly lagging or far behind from the triangle, but again it suits into the triangle. So in the long-term studies where we have find out, then the phaco have slightly better early recovery of 6/9 or anything as compared to SICS. But for near vision is comfort just because of some astigmatism balanced by the different kinds of astigmatism and the suturing technique. And this is the study again published by Boramani sir and another one. They have found out that 19%, 81% of the SICS is having better vision as compared to phaco pupil. And these are the various rates of astigmatism. And here too, they have find out, yes, astigmatism is the one factor where we slightly lack in cases of standard SICS as compared to phaco. Phaco is having lesser astigmatism. But these are the various incision which overcome something to that. When we count out, look into the endothelial count, yes, here you can see the endothelial counting is 3 months and 6 months. This is the endothelial count done by the phaco, and this is by the SICS. You can find out these focal burns in the cases of phaco, but in the SICS there is no difference at early and the late. As far as learning curve is concerned, yes, SICS is having earlier not learning curve required so much. So I am coming to conclusion as my time is over. These are the various advantages and disadvantages of SICS. SICS is having all the advantages in as per literature concerned, except only thing is post-operative astigmatism, which nowadays the smart surgery or smart SICS can be taken care of. Thank you, sir.